A clean, well-made bed not only feels good, but is an important component to an individual's overall health. A well-made bed helps avoid problems such as bed sores and the spread of infection, and provides a sense of well-being and self-worth. Bed linens are usually changed after an individual's bath and any time they become soiled with blood or certain other body fluids. Follow your facility's policies for when beds are to be made. Standard precautions and universal precautions should be practiced, and gloves should be worn when making a bed. This is because you may encounter blood and body fluids that are potentially infectious for HIV, HBV, and other blood-borne pathogens. Also, you should always perform hand hygiene before and after changing the linens, and be careful to hold the soiled linens away from your uniform when carrying them. This program demonstrates the proper techniques for changing bed linens. You will learn how to make a bed that is occupied and how to make one that is unoccupied. While the techniques are similar, there are important differences. Changing an occupied bed can be challenging, but you must be able to do it because some individuals may be unable to get out of bed due to weakness, reduced mobility, activity restrictions, or even unconsciousness. Before you begin to change the linens, be sure to perform hand hygiene. You may want to wear protective gloves for further protection. Make sure you've collected all the linens you need to get the job done right. In most cases, you need a mattress pad, bottom sheet, draw sheet, top sheet, blanket, and pillowcase. You may also need a bath blanket and disposable pads. Stack the linens in the order by which they will be used. This makes handling the linens easier and more efficient. Also, check to make sure there's a hamper or laundry bag available for soiled linens.
Hello, Mr. Green.
Place the fresh linens on a clean overbed table or nearby chair. Greet the individual and tell him what you're about to do.
I'm going to change your bed linen. Is now a good time?
Yeah, you betcha.
It is important to note the individual's level of comfort before you begin changing the bed. Let him know how he might be able to help, if he is able.
Are you able to roll side to side, or do you need me to help you?
No, you know what? I can do it. I can roll side to side.
And do you think you can hold onto the bed rail once we begin?
Yeah, I should be able to.
Clear the work area so that changing the bed linens can proceed smoothly and quickly. Provide privacy for the individual. Be sure to perform hand hygiene. You may want to wear protective gloves while changing bed linens. First, lower the head of the bed to a horizontal position. Remember to check your individual's chart to be sure it is not contraindicated. Also, raise the bed to waist level. This reduces the strain on your back as you work. The table or chair holding the fresh linens should be positioned so you can easily reach them while you work. Loosen the linens at the foot of the bed first. Lift the edge of the mattress with one hand while pulling the linens loose with the other hand. Lower the side rail and loosen the linens at the head of the bed. Then raise the side rail and fold the top linens toward the center. Do the same thing on the other side. Fold or roll the linens toward the center of the bed. Place a bath blanket over him for additional warmth and to protect his privacy. Never shake the bath blanket out. If you do, you may spread lint, dust, or other potentially harmful microorganisms into the air. Due to the normal movement of the individual, his mattress may have slid toward the foot of the bed. If it has, you must move it back to its proper position. Don't do this alone. Get assistance. Next, have the individual hold the upper edge of the bath blanket so that you can remove the soiled top linens. Remove the top linens from under the bath blanket, rolling them toward the foot of the bed. Then, help the individual turn onto his side away from you. Have the individual grasp the bed rail. He can use the leverage to help himself turn. This position may not be comfortable for him. As he turns, note any changes in his rate or pattern of breathing. Adjust the pillow so that he's comfortable. Then, proceed with changing the linens. Roll the soiled disposable pad and gently tuck it under the individual. Then, roll or fold the soiled draw sheet using the same technique. Continue by rolling the bottom sheet and mattress pad to the center of the bed. The more compact the roll, the more comfortable the individual will be when he rolls back over the linens. Continue by rolling the bottom sheet to the center of the bed. You may want to change the mattress pad at this time. If so, follow the same technique by rolling the mattress pad towards the center of the bed and tucking it under the individual. Unfold the clean bottom sheet. Again, avoid shaking it out. Place the bottom hem seam side down. The sheet should be even with the bottom edge of the mattress. Roll or fold the bottom sheet toward the individual and tuck it under the rolled linens. Tuck the bottom sheet under the mattress at the head of the bed. You can now miter the corner, unless you have a fitted bottom sheet. To do this, pick up the edge of the sheet the same distance from the head of the bed as the sheet hangs down the side of the bed. You should see a triangular-shaped portion. Lay that on top of the bed. Now tuck in the portion of the sheet that is hanging over the edge of the bed. Bring the triangular portion down over the side of the bed and tuck the edge of the sheet under the mattress. Continue this motion, moving toward the foot of the bed. As you work, the palms of your hands should be facing up to pull the sheet tight. Now open the draw sheet and place it on the bed with the center fold along the center. Position the sheet so it extends from the individual's shoulder to his knees. Roll the top half of the draw sheet toward the middle of the bed and tuck it under the rolled sheet. The bottom half of the sheet will be hanging over the edge of the bed. Tuck it under the mattress. Begin at the center and work your way toward the edges. Check to be sure that all linens are smooth on the side of the bed nearest you. If disposable pads are needed, place them on the bed at this time. Raise the bed rail to protect the individual. It needs to be raised to assist him in turning so you can change the other side of his bed. Ask the individual to move to the other side of the bed toward you by rolling over the linens. Reposition the pillow and check the individual's body alignment. Do this before you move to the other side of the bed. Once there, lower the bed rail on the side where you'll be working. Remove the soiled disposable pad. You will discard it in the recommended manner when you have finished changing the bed. Be sure to follow your institution's policies for this. Loosen the soiled linens and roll them into a bundle toward the foot of the bed. Now is a good time to check for any misplaced items, such as the individual's eyeglasses, which may have gotten lost in the sheets. Place the rolled soiled linens with the other soiled linens. Carefully pull each layer of the clean linens from the center of the bed over the mattress and straighten each as much as possible. Spread the draw sheet on the bed, and then do the same to the disposable pad. Place the individual in a supine position at the time if he desires. Again, reposition his pillow for comfort and finish making the bed. Tuck the bottom sheet under the mattress at the head of the bed. Miter the corner and tuck the sheet under the mattress. You should work from the head of the bed toward the foot. As you tuck in the sheet, grasp it with both hands and pull it tight. Pull the sheet taut over the edge of the mattress and tuck it in as tightly as possible. The sheet needs to be as tight and wrinkle-free as possible for the individual's comfort. Plus, a tight sheet helps to prevent skin irritation. Now, handle the draw sheet in the same manner. Tuck in the center of the draw sheet first, then both ends. Place the clean top sheet over the individual, seam side up, and unfold it. Be sure to leave enough room at the top for a cuff. Have the individual hold the upper edge of the clean top sheet up to his shoulders. If he cannot do this, tuck the sheet in around his shoulders. This will secure the sheet while you continue working. Also, remember not to shake the linen in the air to open it. Remove the soiled top sheet and bath blanket from under the clean sheet and roll them into a bundle toward the foot of the bed. Place the bundle with the other soiled linens. Next, place the blanket and spread on the bed. Use a fresh one if the one you removed is soiled. Pull it up to the individual's shoulders. Fold the blanket and spread down about 8 inches. Then fold the top edge of the sheet over them. Finally, change the pillowcase. Carefully remove the pillow from under the individual's head. Remove the soiled pillowcase and place it with the other soiled linens. Pull the clean pillowcase onto the pillow. To do so, place one hand inside the pillowcase, holding the pillow with the other. Now gently pull the pillowcase up around the pillow. To avoid possible contamination, never shake the pillow or hold it under your chin. Now, place the pillow under the individual's head. Make sure he is comfortable. Raise the bed rail and smooth the linen toward the end of the bed. Place the soiled linens inside the soiled pillowcase. Carry them so they do not touch your uniform. Place them in the hamper or laundry bag outside the individual's room. Remove your gloves, disposing of them in your institution's recommended manner. And be sure to perform hand hygiene. Miter the corner as explained earlier. Form a top pleat in the blanket and top sheet to allow enough room for the individual to move his feet easily. Lower the bed to the appropriate level and raise the head of the bed to a height that is comfortable for the individual. Move the overbed table next to the bed. Always ask the individual if there's anything he requires at this time, and place a pitcher of water and a glass on the table within his reach. Be sure the call light is within reach. Record any data that you gathered during the time you were changing the individual's linens. Making an unoccupied bed is much easier than making an occupied bed. A well-made bed will help prevent pressure sores, and it will increase the comfort of the individual. Just as in changing an occupied bed, you will need a mattress pad, bottom sheet, draw sheet, top sheet, blanket, and pillowcase. You may also need a bath blanket and disposable pads. First, lower both bed rails. Then lower the head of the bed and raise the bed to waist level. The disposable pad should be disposed of in your institution's recommended manner. Remove all soiled linens at the same time. Place the soiled linens inside the soiled pillowcase. Carry them so they do not touch your uniform. Place them in the hamper or laundry bag outside the individual's room. Now you're ready to put the new linens on the bed. Begin by placing the fresh mattress pad on the bed. Next, layer the clean bed linens on the bed in the order by which they will be placed. Roll or fold the portions that will be used on the opposite side to the center of the bed. Miter the top corner of the bottom sheet and tuck it under the mattress. Now do the same at the foot of the bed, tucking the sheet under the side of the bed as you go. Place the draw sheet on the bed so that the center fold lies on the center of the bed. Tuck it under the edge of the mattress. Next, place the top sheet of the bed followed by the blanket and spread if needed. Miter the corners of the top linens. Make sure they are as smooth and wrinkle-free as possible. Remember that this provides greater comfort and helps to prevent skin irritation. Now move to the other side of the bed and follow the same steps. Begin at the top and work your way to the foot of the bed. Miter the corners. Once you have tucked the bottom sheet in, pull the draw sheet tight and tuck it under the mattress. Smooth out the top linens. and miter the corners. Replace the pillow on the bed only after you have placed a clean pillowcase on it. Once all the linens have been changed and tucked in tightly under the mattress, fan fold the top sheet and blanket toward the foot of the bed. Now the individual can more easily slip under the covers of his freshly changed bed. Adjust the height of the bed so the individual will not have any difficulty entering or exiting the bed. Record any data that you gathered during the time you were changing the linens. A well-made bed helps prevent pressure sores and promotes comfort and a sense of well-being. By following correct bed-making procedures, you help to ensure that the individual's skin won't become irritated.